A warm welcome to one and all to this first International Conference on Technologies for Smart Green Connected Society. I'm Dr. Shirin Khan, and the topic of my presentation today is Public-Private Partnership Model in Healthcare Sector. Is it a sustainable approach? Co-authored by Dr. Sangeeta Jari and Dr. Neha Mathur, Ravindranath Tagore, Deemed University. Before starting the presentation, let me give you a brief idea what a public-private partnership ensures. The social sustainability of public-private partnership was suggested as consisting of equal cooperation relationships, sustainable stakeholders, a transparent process, and having credible accountability integrated as a conceptual framework between the public and private sector. As a result of which, economic sustainability is perceived in the form of economic growth, employment promotion, innovations, infrastructure construction, as well as industrial development through project delivery. Both the public and private sector recognize their individual inabilities to address the emerging public health issues that continue to be tabled on the international and within country policy agendas. Thus, many governments deal with such problems now by establishing public-private partnership PPP between healthcare providers, building management companies, and financiers. PPPs in the healthcare sector, therefore, seem to be both unavoidable and imperative. The relevance of this study. The present study is an attempt to assess the perception of individuals towards the public-private partnership model in health sector. Why was this important? Despite the relevance of such an important confluence between the public and the private healthcare sectors, we have to understand the significance of the acceptance of this concept by the people of a vast country like India, which has a population belonging from diverse social, cultural, and economic backgrounds. Therefore, this study is an attempt to assess the perception of individuals towards the public-private partnership PPP model in healthcare sector, with a small attempt to cover of public-private partnership model in health sector and how an individual perceives it. The study is limited to Madhya Pradesh state of India. The research is empirical in nature and is based on both primary and secondary data. The data has been gathered from 390 respondents belonging to Madhya Pradesh districts with the help of questionnaires only. Globally, studies have been going on from years to understand the significance and impact of the public-private partnership in healthcare sector, especially in the developing countries, where in particular the economic returns derived from alleviating fiscal pressures and stimulating sustainable local economic development have been seen as the primary drivers of adopting the public-private partnership to achieve economic sustainability. Shan, Lam, Chan, Chong, and K in 2009. In Vietnam, private healthcare providers deliver 60 to 70% of ambulatory care and up to 4% of inpatient services. And in all the above examples of the countries that we have seen, public-private partnership is largely considered a promising alternative to the inadequate and sometimes inept public health system, which fails in particular to provide healthcare services for the rural poor. This brings us to the research design of this study. The objective of this study was to assess the perception of people regarding the quality of healthcare units under public-private partnership model in the study area. The research approach and method used was based on abductive approach. The type of research is empirical and research design is descriptive in nature. For the purpose of collecting primary data, online survey method was used as observing the COVID-19 pandemic situation. A well-structured and self-developed questionnaire was prepared based on linear scale. Snowball sampling technique was used to collect the data. Sample size was of 500 participants, while data was collected from 400 respondents. Further, to check the difference among the respondents' perception towards the quality of healthcare units under public-private partnership model, below mentioned hypothesis was developed. HO being there is no significant difference among the respondents towards the perception of the quality of healthcare units under public-private partnership model on the basis of gender, and H1 being there is no significant difference among the respondents towards the perception of the quality of healthcare units under public-private partnership model on the basis of gender. The data analysis method has been interpreted by calculating frequency percentage analysis and non-parametric tests ANOVA. There are limitations to this study. The study is restricted to the selected sample of Madhya Pradesh, state of India. Therefore, the results of the study cannot be generalized. The statistical tool used to analyze the data has its own limitations. The data analysis and interpretation part is on the basis of the wide variety of responses collected from the various participants of the study. As can be seen from the first graph, out of all the respondents participating in the study, 208 respondents were male and 192 were females. So there was just a small variation in the gender, which does not provide any wide impact on the study. Further, to test the reliability, alpha Cronbach reliability test has been applied. The value of reliability comes out to be 0.8, which is greater than 0.5, indicating that the structured tool is a reliable way to collect the data. Furthermore, moving on to the graph depicted in the slide, which are a few examples of the many data points being examined and collected from a study of 390 or so participants. The first graph gives the response to the question whether the behavior of the doctors and nurses might improve while working with the private hospitals. And as observed from the above graph, it has been found that out of the total respondents participating in the study, majority of the respondents, that is 131, strongly agreed and 139 agreed, respectively, with the fact that the behavior of doctors and nurses might improve while working with the private hospitals when government sector nursing homes would start working in partnership with the private nursing homes. This is because they feel that private nursing homes have adequate staffing, which provides managerial support and patient-centered culture. So the nurses of government hospitals might improve their working capabilities in collaborating with the private hospitals. Similarly, the other graph depicts the response to the question, private quality treatment will become more accessible to the poor or not. As seen from the graph, it can be interpreted that the total respondents participating in the study, out of the total respondents, the majority of respondents, that is 143, strongly agreed and 118 agreed, respectively, with the fact that private quality treatment will be more accessible to the poor when government sector nursing homes would start working in partnership with private nursing homes under the PPP framework. This is because under PPP framework, government hospitals would be helping each other for the social development through the combined efforts of both public and private hospitals. So the treatment of private hospitals will now be easily accessible to poor under the PPP framework. Earlier, when there was no PPP framework in place, it was not possible for the poor to get treated in the private hospitals as they would have costed much more than they could have afforded. This brings us to the hypothesis testing. As we know, there is no significant HO depicts that there is no difference among the respondents towards the perception of the quality of healthcare under the public-private partnership model on the basis of gender. So in order to further test the hypothesis, one-way test ANOVA has been applied. Since F value comes out to be 2.181 and the P value is 0.141, which is greater than 0.05, it indicates that there is no significant difference among the respondents in the perception towards the quality of healthcare under the public-private partnership on the basis of gender. As mentioned above, the p-value is 0.141, which is greater than 0.05, indicating that the null hypothesis is accepted. H1, which stated that there is a significant difference among the respondents towards a perception of the quality of healthcare units under public-private partnership model on the basis of gender. Once again, the one-way ANOVA test was applied to test the hypothesis. One-way test was applied and the results showed that since F value comes out to be 0.684 and the P value is 0.604, which is greater than 0.05, indicating that there is no significant difference among the respondents in the perception towards the quality of healthcare units under public-private partnership model on the basis of gender. As mentioned above, the p-value is 0.604, which is greater than 0.05, indicating that the null hypothesis is accepted. This brings us to the conclusion. Gender-wise difference in perception is not there, but overall the people are inclined towards better healthcare services. That's why they are in favor of the public-private partnership model of healthcare sector in a full-fledged manner, as in terms of infrastructure, staff, and services, and quality care within financial budget. Under a public-private partnership arrangement, there's no inbuilt mechanism other than patient demand or choice that would induce a greater number of hospitals to offer more services, thus proving the importance of this study on the perception of people regarding the public-private partnership model in healthcare sector. Since it has been found that the creating information, feedback, close monitoring, evaluation of the behavior of healthcare sector of both private and government nursing homes performance over time is quite imperative for the betterment of healthcare delivery under PPP framework. Therefore, it can be said that public-private partnership is a sustainable approach. These are my references and the bibliography. I thank you all for being a part of this presentation and giving your precious time. Thank you.